lecture. So, why is CHW training important? And so I'm looking, like I said, I wasn't here last week. I did not get to familiarize myself with the audience. And so I don't know you all individually yet, hoping to learn more about you more towards the end. But I do know that sometimes some of us are here, we join these types of trainings because we are maybe in a leadership role. Maybe we want to understand what is a CHW? Do I really need to integrate this particular public health professional into my clinical setting or into the work that we are doing here? And if so, what kind of training do they need? Do they need training at all? Why is that important for CHWs to have? Some of you may not even be CHWs yet, but you're interested in the field. And so you want to know what all needs to be involved in me becoming a CHW? What does training look like? Right? What will I be able to do? So here's why CHW training is important. It ensures that community health workers, we are prepared, we are confident in our roles. It standardizes the knowledge and practices to maintain quality and effectiveness. And it empowers us as community health workers to be trusted liaisons between healthcare providers and our communities. So this is why we provide training. This is why we encourage training. Even if you're from a state that doesn't mandate that you become certified in order to be a community health worker, we are strong advocates and proponents for standardized trainings for these very reasons. And so competency-based learning is the most important aspect of CHW training. Competency-based learning focuses on skill mastery rather than just that theoretical knowledge you may receive. It helps us as CHWs to apply learning in real world settings and supports our in order to support individuals and families more effectively. It ensures that the training aligns with evidence-based public health and healthcare practices. To be competent means that you have the ability to do something successfully or efficiently. And so competency-based instruction is where we teach someone something and then we have them to demonstrate what we've taught so that they can show mastery of the subject. This is one of the ways that we recommend that teaching CHWs at Umemba Health. And so one thing that Quisha is a master of at Umemba Health, now I'm throwing in my own plug here, is super strong objective building. At the end of anything that you do through Umemba Health training, you will be able to X, Y, and Z. You will be able to apply what you've learned. You will be able to demonstrate. You will be able to create. You will be able to list. And so when we talk about competency-based instruction, it's also important to remember that the trainings are not one size fits all. CHWs represent the community in which they come from. And so if community interventions are tailored for community members, then doesn't it make sense that CHW training is also customized? So last, we believe that there's an art and a science to training community health workers. Art means something intuitive and subjective, a skill cultivated through practice. And science, on the other hand, means it's backed by research, methods, various approaches, and it can be objective and it can be measured. So our goal today is to share some of the arts and science with you as well as information and resources so that you can support your organization to train CHWs more effectively. So there are 6 key elements of structured CHW training programs. So competency-based curriculum is number 1, and this is where we make sure that the training is aligned with the national and state CHW certification requirements. 2, hands-on learning being where we incorporate field work, case studies, role playing. 3, culturally responsive education. This is where we are teaching CHWs how to work effectively with diverse populations. 4 is that ongoing professional development. So we are encouraging continuous learning through refresher courses and advanced training. 5, evaluation and feedback. This is where we assess the users to measure skill acquisition and effectiveness, right? Did we meet those objectives? Did we meet what we said at the beginning? Learners will be able to accomplish X, Y, and Z when they finish this program. And then lastly, number 6, that we meet national and state CHW training requirements. And so we want to ensure that CHW programs comply with state and national guidelines to ensure that CHWs meet certification and workforce standards. So requirements for CHW training vary by state, but often include a minimum number of training hours or core competency areas and continuing education mandates. And so if you're looking for state specific information, a good place to start is the National Association of CHW's website. So National Association of Community Health Workers, sometimes you'll hear it pronounced like NACHWA. That's usually what folks are talking about. This is their website information here on your screen. If you click on the resources drop down menu, select CHW network and association resources, that will allow you to view the networks and associations and certification and training programs by state and find out what's most relevant for you. So some national recommendations. We recommend the c3council.org website if you're looking for national recommendations. This council defines comprehensive CHW roles, skills, and qualities. This council establishes national consensus on CHW standards and provides guidance for improving CHW practices and policies. And so if you look here in your chat, Quisha has provided some links there to these resources that I'm discussing.